Asthma. Asthma is a disease affecting the airways that carry air to and from your lungs. People who suffer from this chronic condition are said to be asthmatic. The inside walls of an asthmatic's airways are swollen or inflamed. This swelling or inflammation makes the airways extremely sensitive to irritations and increases your susceptibility to an allergic reaction. So, to understand asthma, it helps to know how the airways work. The airways are tubes that actually carry air into and out of your lungs. Asthma patients are known to have inflamed airways. As a result, the airways become swollen and sensitive. And because the airways are inflamed, the muscles tighten and the airways narrow. More mucus is produced, and within the narrow airways, less oxygen is passing through. So, what actually causes asthma to occur? Exposure to various substances that trigger allergies or allergens and irritants can trigger signs and symptoms of asthma. Asthma triggers are different from person to person and can include airborne allergens such as pollen, animal dander, mold, cockroaches, and dust mites, respiratory infections such as a common cold, physical activity, which is exercise-induced asthma, cold air pollutants and irritants such as smoke, certain medications including beta blockers, aspirin, ibuprofen, and naproxen, strong emotions and stress, sulfites and preservatives that are added to some types of foods and beverages, including shrimp, gastroesophageal reflux disease or GERD, which is a condition in which stomach acids back up into your throat, and the menstrual cycle in some women. The physiology behind asthma. Well, asthma includes a background on the lungs and the airways of the body. The main function of the lungs is to supply adequate oxygen to the blood and to remove carbon dioxide from the blood. The proper exchange of these gases between outside air and the air in the depths of the lungs depends on clear, unobstructed air passages. Remember, air enters the body through the nose and the mouth and travels down the trachea into smaller airways, which are known as the bronchi and bronchioles. The smallest airways are microscopic in size and end in clusters of tiny air sacs called alveoli. The walls of the capillaries in the lungs and those of the air sacs are thin, which permits the passage of gases between the airway system and the blood. When you breathe in, the lungs fill with air containing oxygen, which can then enrich the blood. When you breathe out, carbon dioxide, which has been removed from the blood, is expelled by the lungs. So asthma is when the excessive mucus or secretions and inflammation of the airways causes swelling and tightening of the smooth muscle around the airways. This results in airflow is restricted and the normal functions of the lungs are affected and breathing becomes more difficult. The symptoms. Common signs and symptoms of asthma include coughing, wheezing, chest tightness, and shortness of breath. Coughing from asthma often is worse at night or early in the morning, making it hard to sleep. Wheezing is a whistling or a squeaky sound that occurs when you breathe. Chest tightness may feel like something is squeezing or sitting on your chest. Some people who have asthma say they cannot catch their breath or they feel out of breath. You may feel like you can't get air out of your lungs. But also note that not all people who have asthma have these symptoms. However, these are the common symptoms. So how do doctors actually diagnose a patient with asthma? Well, before examining the types of tests used, let's look at the beginning stages of a diagnosis. First, your primary care doctor will diagnose asthma based on your medical and family histories in a physical exam even before looking at test results. Your doctor will also figure out the severity of your asthma. That is, whether it's intermittent, mild, moderate, or even severe. The treatment your doctor prescribes will depend on the level of severity. When testing time comes, your doctor will use a test called spirometry to check how fast your lungs are working. This test measures how much air you can breathe in and how much air you can breathe out. It also measures how fast you can blow air out. Your doctor may give you medicine and then retest you to see whether the results have improved. If your test results are lower than normal and improve with the medicine, and if your medical history shows a pattern of asthma symptoms, your doctor will likely diagnose you with asthma. Your doctor may recommend other tests if he or she needs more information to make a diagnosis. These other tests may include allergy testing, which is to find out which allergens affect you, if any, as tests to measure how sensitive your airways are. This is called bronchoprovocation. Using spirometry, the test repeatedly measures your lung function during a physical activity or after you receive increasing doses of cold air or a special chemical to breathe in. A test to show whether you have another condition with symptoms similar to asthma, such as reflux disease, vocal cord dysfunction, or sleep apnea, or a chest x-ray, or an EKG. These tests will help find out whether a foreign object in your airways or another disease might be causing your symptoms. The prognosis. Asthma is usually chronic, although it occasionally goes into long periods of remission. Long-term outlook generally depends on the severity of your case. For example, in mild to moderate cases, asthma can improve over time and many adults even become symptom-free. Even in some severe cases, adults may experience improvement depending on the degree of obstruction in the lungs and the timeliness and effectiveness of treatment. In about 10% of severe persistent cases, changes in the structure of the walls of the airways lead to progressive and irreversible problems in lung function, even in aggressively treated patients. Lung function declines faster than in average people with asthma, particularly in those who smoke and in those with excessive mucus production. Overall, one study even reported that 72% of men and 86% of women with asthma had symptoms 15 years after an initial diagnosis. Only 19% of these people, however, were still seeing a doctor, and only 32% used any maintenance medication. It is important to note that death from asthma is relatively an uncommon event, and most asthma deaths are preventable. It is very rare for a person who is receiving proper treatment to die of asthma. So, since we have been discussing the immune system recently, what is the relationship between the immune response and asthma? In response to allergens, the immune system actually takes time to deliver white blood cells to the airways. The immune system also delivers other immune factors besides the white blood cells. Together, the white blood cells and immune factors are known as the inflammatory factors. These inflammatory factors cause the airways to swell and fill with fluid. They also produce a thick mucus. Treatment of asthma. Asthma is a long-term disease that has no cure. The goal of asthma treatment is to control the disease. Good asthma control will prevent chronic and troublesome symptoms such as coughing and shortness of breath, reduce your need for quick relief medicines, help you maintain good lung function, let you maintain your normal activity level and sleep throughout the night, and prevent asthma attacks that could result in an emergency room or visit to the hospital. To control asthma, you should partner with your doctor in order to manage your asthma or your child's asthma. Children aged 10 or older and younger children who are able should take an active role in their asthma care. Taking an active role to control your asthma involves working with your doctor to treat other conditions that can interfere with asthma management, avoiding things that worsen your asthma, working with your doctor and other healthcare providers to create and follow an asthma action plan. There are also some asthma medicines. For example, some patients use inhaled steroid or bronchodilate inhalers. There are also inhalers known as asthma nebulizer. A nebulizer changes medication from a liquid to a mist so that it can be more easily inhaled into the lungs. Nebulizers are particularly effective in delivering asthma medications to infants and small children and to anyone who has difficulty using an asthma inhaler. It is also convenient when a large dose of an inhaled medication is needed. Nebulized therapy is often called a breathing treatment, and a variety of medications, both for immediate relief and maintenance of asthma symptoms, are available for use with a nebulizer. Nebulizers come in home and portable models. The incidence of asthma. So basically, I am about to discuss the demographics of asthma. As shown in this picture, which was taken in 2012, asthma affected 1.3% more children than adults, 2.5% more females than males, 3.8% more blacks than whites, and 4.9% more blacks than Hispanics. One fact that always amazes me is that asthma accounts for 14 million missed school days each year. Out of 17 million people affected with asthma in America, 5 million of those people are children. Asthma prevalence increased from 2001 to 2010. Certain demographic groups had higher asthma prevalence. Children aged 0 to 17 years, females, black persons, persons of multiple race, Puerto Rican persons, and persons with a family income below the poverty level. One report actually examines rates for asthma outcomes for persons with asthma rather than for general population. Rates for the general population represent the burden of asthma in the United States. Rates for the population with asthma take into account changes in asthma prevalence over time and differences in asthma prevalence among demographic groups. From 2001 to 2009, rates for emergency room visits and hospitalizations per 100 persons with asthma remained stable, while rates for asthma visits in primary care settings and asthma deaths declined. For the period from 2007 to 2009, asthma rates per 100 persons with asthma in primary care settings for black persons were similar to those for white persons, but rates for the emergency room visits, hospitalizations, and deaths were higher. Compared with adults, children aged 0 to 17 years had a higher rate for asthma visits in primary care settings and in ERs, but had a similar hospitalization rate and a lower asthma death rate. So before I end this presentation, let's talk a little about common advice and facts about asthma. Always remember, to prevent an attack, you can do a number of things, such as use allergy-proof pillowcases, mattresses, or even the pillow itself. Do not allow pets in your bedrooms or on the furniture if a person in your home has asthma. Also, this is kind of weird, but fix leaky faucets. You might ask, why leaky faucets? Well, actually, mold forms in a moist area, so if there is a leaky faucet, mold will be there. This could result in a causing reaction or an attack with the person who has asthma. Most importantly, know your own body. Know what is normal and what is not normal, and how your body functions. Thank you for taking the time to listen to my presentation.